I don't see, okay. I don't see a camera. There we go. Okay. All right. So here we are. Thank you for your assistance. Um, Good afternoon. My name is Dr. A with Angels Core Care, and I am a physician who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to enrich how you feel about yourself and improve your quality of life. Um, I'd like to welcome you to this program. This is my first Facebook Live, and I'm very excited. We had a little technical glitch earlier where my video wasn't there, but here we are. But I'd like to welcome you to this program. And if you are here live, first of all, thank you so much for joining us. And please go ahead and text or comment hi in the comment section. If you are watching the replay, then please put replay under comments, as we would be very excited to know that you came to join us, and we try to respond to all the comments that we receive. So my topic today is one that it may not affect you directly, but it might. It might affect somebody you know. It's a serious medical condition, and the death rates from it have increased since the COVID-19 pandemic, especially here in Ohio. If you have this disorder, you're not alone, and anyone can get it. It doesn't mean you're a bad person. It doesn't mean that you lack willpower, but it simply means that you have a medical condition that is more common than a lot of people think. And the condition that I'm talking about right now is opiate use disorder. So I first got introduced to opiate use disorder back when I had a colleague, physician, who was treating patients with opiate use disorder. And at that point, I was not interested in treating opiate use disorder until I had my very first patient who came to see me in my family medicine office. And this patient was giving some signs that there were some problems. And finally, he admitted that he had this problem. And so we decided to come up with a treatment plan. But this individual, he was, for lack of a better phrase, a quote, normal person. He went to church where I went to church. His kids were in Sunday school with my kids. And it really opened my eyes, and it really opened my heart and my compassion to individuals with opiate use disorder, because I feel a lot of times they don't know where to go for help. They don't know what they have. There's a lot of stigma associated with that. And so to be able to help individuals is really one of the passions that I have. So, so what exactly is opiate use disorder, and how common is it, and what can be done about it? Well, as I said before, it's a very common condition, and it doesn't mean that you are a bad person or that you lack willpower. And I've treated doctors, attorneys, college professors, homeless individuals, students, and all sorts of other subgroups. And we've treated them successfully. Treatment works, and it's always exciting to see them get their lives back. So again, it's common. This is some information taking from a handout complimentary of Orexo. I am not financially receiving anything from Orexo. I just like to use this when I speak with my patients. But how common is this? First of all, you're not alone. Anyone can become dependent on opiates. Again, it does not mean that you're a bad person, or it doesn't mean that you lack willpower. And these are actually numbers from 2013. But in the United States, at that point, 5.1 million people were misusing opiates. Most recently, those numbers have actually jumped in 2019 to 10.1 million people aged 12 or older misuse opiates in the past year in the United States. In addition, this number's changed. So now over 3 million people in the United States have opiate use disorder, and over 16 million people worldwide have opiate use disorder. So again, a very, very common condition. So now, what is opiate use disorder? It used to be called opiate dependence, but now it's known as opiate use disorder. Oh, and let me say hi to Lita here. Thank you so much, Lita. Thanks for joining me. But what is opiate use disorder? Opiate use disorder, first of all, it's chronic. That means this is not going away. This is not strep throat where you treat it for 10 days and it goes away. This is something that you're always going to have to deal with. It's relapsing. That means things get better and things get worse, just like diabetes, just like high blood pressure. You may be in treatment for it, but things can fluctuate and relapse with time. And it's a result of either legitimate use of opiates, meaning taking something the way that it was prescribed for you, or misuse of opiates, meaning taking something either not the way that it was prescribed for you or something that wasn't prescribed for you to begin with. But what happens is that with frequent opiate use, the brain actually undergoes physical changes so that the brain starts to think that it needs opiates in order to function normally. And so when the brain is using this, if the brain, if you can picture my hand, the brain has its opiates, it's feeling normal, it's happy. Well, now it doesn't have the opiates. Now it's down like this. Now it's cranky. Now it doesn't feel well. Now you're going to have withdrawal symptoms. Now you're going to have these cravings. You don't feel well, kind of fluish. And the way you feel better, unfortunately, is then going back and taking more opiates. And so the brain's happy, you have opiates, you don't have the opiates, you're craving, withdrawing, you feel horrible. And it creates this vicious cycle. And that's what opiate use disorder is all about. And it's very hard for people to break through that cycle. Again, there's no known cure. So one of the goals is to control the symptoms. Some people are more likely to develop opiate use disorder than others. Relapse is common, but it can be successfully treated with the right treatment plan, and you can still live a healthy, productive life with the right treatment plan. So, if this information has been helpful for you, whether you have opiate use disorder or not, please comment helpful. And then also please share the video because there's other people out there who may have this condition as well. If you or someone you know does have opiate use disorder, we are here for you. We are here to help you. Please either call us at 614-442-2600 or visit our website specifically designed to help patients with opiate use disorder, which is www.midwestsuboxone, SUBOXONE, doctor.com. If you share this message with others, you could be instrumental in saving their lives. Again, a lot of people don't know the condition exists. They don't know that there's treatment available out there. And hi, I see a couple other people. And so we want to get the message out and let people know that treatment is available. We're here to help. If you think you have opiate use disorder, I have seen patients graduate. I've seen them buy houses. I've seen them get promotions. I've seen them get married. I've seen them have other great successes in life because they finally got treatment. And if this can happen with them, think about what control over your life you would have with treatment. Again, I'm Dr. A with Angels Core Care. I am a board certified addictionologist. I do specialize in the treatment of opiate use disorder and other addictions. And I thank you so much for joining us. And we'll be back here next Thursday at 12:30 p.m. Eastern Time as well. Look forward to seeing you then. And again, if you find this information helpful, please type helpful in the comments section as well. And then be sure to share it with somebody else. Thank you so much and have a great day.